So today I just wanted to share with you guys, since Nevaeh has been having a bad year, and if you're just joining me now, Nevaeh is my dog. She is my baby. Aloha everyone. Welcome back to my channel. Christy Lani here, and hope you all are having a fantastic day. It is December 1st, and I just wanted to share with you guys my dog's symptoms, because she's been having a hard year this year, I guess, but first of all, I think it was last November, it's when we found out she had some mast cell tumors on her body. And if you guys don't know what that is, that's cancer, like a skin cancer for the dogs. I feel like humans have that same thing too, but it's for dogs. At the beginning of it, I feel like she's had this continuous, they were saying it's like a fatty cells, nothing to worry about. I want to say it was years ago. I want to say it was I want to say 4 years ago, because I used to ask the doctors, oh, is this any concern? No, it's just a fatty tissue, whatever, blah blah blah. It's just, it used to bleed. If I have a picture, I will put it here, but it's a bump that bleeds. So imagine if that was cancer at the beginning. I'm lucky that it wasn't it was a low grade cancer when we did her surgery. But if your dog is having those pop up all the time, I don't even remember if it was like soft. It never came hard, the bump, but it would bleed just bleed on its own. And she had that. So when I did finally have the money to get it tested, I got it tested and it was cancer. So that was back in November 2023. So we were going to VCA, but at that point her regular doctor at VCA had moved away. So we were just going to VCA Pet Hospital in Kapolei just for the shots and stuff. And she was doing her dental cleaning there as well, because they do have a wellness plan where you can get monthly payments for your dog's care. It covers preventative service. So now she's a senior, it would cover her blood work, an x-ray, and then I got the one with the dental plan, so that would be costing a little bit more. It'll take care of your dental plan, your anesthesia, the whole dental cleaning. It won't take care of the medicines like to take home, and if you have to pull a tooth, it won't take care of those stuff. And that wellness plan will not take care of any surgeries or anything like that. It's all about their shots, their dental cleaning, anything that's preventative. And even for the whole year, it'll take care of the pet visits. So you can go without having to pay the pet visit. You just would pay the monthly plan. I found that had helped us a lot. Especially she needed a cleaning, and I couldn't pay like the whole whatever 1,000 or 2,000 at one time. So it helped because I could pay it monthly. And that was a really big help for me, especially to take care of my dog. Yeah. So if you don't have much money and you want to take care of your dog, the preventative services that VCA hospitals have, it's very helpful. No sponsorship here, but that really helped me, and it serves its purpose. And then now we're at this point, we don't go to VCA anymore because her doctor that was there that left, we went back to her to do the surgery and stuff, because she took care of my sister's dogs and she did their surgeries and stuff like that. So right now we're going to Manoa vet clinic. That's far from where we live, but it's okay because we like her. We trust her words. And she's always, you know how you have some doctors, they just come in, they don't even talk to the dog, they just, you know, but she talks to Nevaeh, try to make Nevaeh feel comfortable. It's a whole different thing when it comes to pet care with her. Her name is Dr. Kwok. She's in Manoa Pet Hospital. But she did a fantastic job on Nevaeh's surgery. I think Nevaeh was really shocked when she came home. She was like crying to everybody about, you know, if she see like my brother-in-law, she would be crying to him like that. I guess she wants to tell her story to everybody, that bad mommy got her all this cut on her thing. But she needed the surgery. We got the surgery. It was a little bit over $2,000. Well, I don't know. I gotta go and look how much everything costs, but we have to get the biopsy. That was about 300 something or something like that. And then we had to get her surgery. If we went to another surgeon, like oncologist, that would have been skyrocketed higher of a payment. But since it was just like on the skin, and my doctor had done those before, so we had no problem just going there and having her do it. And it cut the cost down a lot. And then after one of her surgeries, I noticed that her eye was like really small. It was really small. Okay, wait, hold on. Go back to having the cancer. She would always be itchy, scratching, itchy. And one thing with that, that cancer, it releases histamines, I guess. Like it's like an allergy for them, so they'll be scratching a lot. And I didn't think, oh, it could be the grass and all that stuff, but no, it was probably the cancer. She would have to get Apoquil shots that wouldn't help. She would take the other medicine. I forgot what that one was named. Oh, she took the shots at one point. She would get a monthly shot for the itchies, but I feel like those stuff didn't work. And I spent so much money before on dog food for her. Never found a dog food she likes. Right now, she will eat the dog food now. I mean, since we've seen Dr. Kwok at VCA, she would eat this dog food. It's Hill's prescription diet, the low-fat ID. That's the one she'll eat all. She would just eat it. But I was trying so much different dog foods and stuff. She didn't ever eat it. Because before, if you guys are just following me now, I was in an addiction, homeless, and stuff like that. And Nevaeh was with me. So I would feed her like some of my plate, human food. Because no matter what, they would not eat no dog food back then either. And now she eats the dog food. But I do give her some, you know, chicken sometimes. I feed her some lamb. You know, I'll give her some treats like that. But she will still go back to eat her dry dog food. So that is great. And look, the kitty cat. There's a kitty cat that's walking. But yeah, so but now she's been eating that dog food for a long time, and she doesn't have no itchies. I noticed that when she was eating that dog food, she had no itchies, and she just was doing really well with that dog food. But anyways, fast forward to her surgery. She had, after the surgery, I just noticed that she had her eye, and it was like, I put a picture here of how she looked. I didn't really catch a picture of the redness in her eye. It's hard to see the dog's eye that is red because you can only see the black, but when you do that, it was so red. And it would be really like this all the time. Okay, so at the beginning, Dr. Kwok gave her this medicine here. Let me see, hold on, let me get my glasses. This medicine here, It is Neopolydex, something like that. Neopolydex. Okay, so this one has like antibiotics and steroids, but the first one she gave him was just the antibiotics. That didn't really help. So this one with the steroids and the antibiotics worked. So Nevaeh was on this, okay? She was on this medicine, eye drops, for a long time. I want to say 8 months, okay? She was still on the eye drops. Okay, 3 weeks later, okay, I hope you guys are following along. 3 weeks later, after her surgery for the mast cell tumor, 3 weeks later, another one popped up by her hip. So one on her rib and then down by her hip. So we had to do another surgery, maybe a month apart or a little bit over a month apart. She had another mast cell tumor surgery. She had 2. Yeah, so she had 2. Good thing the doctor could do it again. It saved us a lot of money. And then that was it for the mast cells. But yeah, the doctor said that that was the fastest she ever seen another one pop up 3 weeks after. So I do join the mast cell tumor group on Facebook, and a lot, it will tend to pop up after. You know, we're praying that she's been good for this whole year with that. But now, and then she was on the Benadryl for a long time, since November or a little bit before that, last year. She was on Benadryl, 1 pill twice a day. They use that for cancer treatment for the dogs when they have the mast cell, because it releases histamines and it will make them itchy. So she was on that for a while. And then, I don't know, we had to go to an eye doctor as well for the redness of her eye, because this is after she had all her surgeries. She still had that eye thing. The medicines wasn't helping. So we spent $300 something for an ophthalmologist. The doctor looked into her eye, gave her some medicine, and said it was dry eye. They couldn't find anything, thank God. They couldn't find anything but dry eye, okay? And then the doctor did give her this one here. It's Optics Care Lube Eye Plus. This thing here, it irritates her eyes. It made it made it worse for her, okay? I mean, it would not help it. And then the doctor gave her another eye drops that irritated her eye as well. So we went back to Dr. Kwok, because I don't want to pay $200 something to do a follow-up visit, you know, and then it's just no. So I went back to Dr. Kwok. We paid $80 per visit, and then she just told us to keep Nevaeh on this. So Nevaeh was on this for a long time, okay? The antibiotics with the steroids, and I know it's not good to be on steroids for a long period of time, but it was okay because it was helping Nevaeh. Okay, and then, you know, Nevaeh would have like this situation was happening before her cancer surgery, maybe 2 years prior. She would always be aggressive at night. If I move in my bed and she's on her own bed, she would growl at me. I would put a video, if I can put it here, I will. She would,
You okay?
growl,
Huh?
bark, any movement that I do. And then I finally really I'm like, doctor, I showed them videos of her doing that before. They never really had any concern, but it would be like, sorry, my eyes itchy. They would be like, you know, not really a concern, but for me it's a concern because I couldn't sleep. Nighttime, I having a hard time sleep. I'm arguing with her. Nevaeh, you know, stop it. And then sometimes she will go for me, like try to attack me. And I just like, you know, doc, I'm really it's really getting out of hand already, her aggression at night. So now Nevaeh is on the ibuprofen. It's like it's called gabapentin and Rimadyl. So the Rimadyl is like ibuprofen, and this is another pain medicine. So she's on 2 of these at night. She only takes them at night. Okay, and guess what? She's been on this. Her eye cleared up. There's no redness in her eye. Like, she was on this thing for months, right? This eye drops. I mean, I hope that can teach the doctor, you know, a similar lesson here about the eye drops not working. Give them ibuprofen. You know, maybe it's not only about the eye, but you know what I mean? So right now her eye is doing very well. Thank God, right? Because it was really red. I would be in pain too. I would be grouchy too. So we're trying to see if she's has any pains. That's why she's having aggression at night, or some kind of dementia. But she started to be like that when she was like 7 years old, I want to say. When we moved into this house, she started to act that way. I thought it was just kind of like a behavior situation, but we're still doing testing for if it could be dementia or some sundowners thing. I joined another group on Facebook. That's something really good about Facebook. They have all these different groups. You can see how other dog moms or dog dads are in their situations and what they're doing for the dogs. So she's on this medicines now. Every night I give it to her, and melatonin, I give her that too, but I have to remember to go buy that one. But I did order her some CBD chews. It taking so long for that one to come in. I bought it over like a month ago. It's called Elevate. My doctor recommended that one. But one thing, I guess shipping to Hawaii is, and then Christmas time, I don't know why it's taking so long, but it is, and it should be here tomorrow. It should have been last month, but they changed the schedule. Like, why? Did it get lost? But we're gonna try the CBD chews for her. And then, yeah, so she wasn't having a great year for Nevaeh, but she's doing good now that she's on the medicines. She'll still have some outbursts of barking at night if I move, slight, but not as bad as before. So, you know, keep in mind when your dog is lashing out or having a different behavior, it's really not about their behavior like how humans is. Humans, they'll do things just in spite or because they want to, or you know what I mean? But for dogs, they don't think that way, where they will just do something intentional. So if your dog is acting out different behavior and stuff, it's probably something medical. It's hard because the doctors don't know. If I feel like something is like maybe she was having headaches from this eye pain, you know, because she would always like rub her head against the rugs and stuff. But now she's doing okay with her eye, so that's a lesson learned. Instead of giving eye drops, maybe to ask for some ibuprofen. Sometimes, you know, you never know if they're in pain. She is already 9. She will be 10 years old in February. So she's getting up there in age. She's still like feisty, and she'll still run in the daytime. She's normal. When we go out shopping, she's normal. Nighttime come, I guess if I'm sleeping, I don't want somebody to bother me. So she's sleeping, I'm on the couch watching TV, I might have a cough. She'll like growl and look at me like, "Urgh," like, you know. So some humans do that too, right? If you bother them when they're sleeping. But she comes by me and then she knows that she's gonna fall asleep and she'll do that. So yeah, I just thought this was a good video to share about, you know, the symptoms of my dog. And I don't know, maybe somebody else is going through that. It's like at night she'll bark like somebody's touching her or hurting her, you know, and nobody's by her. So we're still testing out things for her. But I don't want to, the doctor said I could like adjust the medicines, but I'm like, oh no, we're not gonna give her more doses, like a higher dose. No. So we're just like, since I was dealing with that for a long time, I can deal with just a little bit of it, right? And hopefully when the CBD comes in tomorrow, that would start to work for her. But I'll keep you guys informed if you guys want to see how the CBD works for her and calming her. But yeah, so that's her story. But she's doing very well after her surgery. The first one was a shocker to her. The second one was like she knew what to do already. So, you know, just keep in mind if your dogs are acting out, you know, there's something probably wrong with them. I would take them to the doctor and stuff. But yeah, so that's our story. And if I can't find an editor to put the pictures on the side, because some editing things, they don't have that option, I will just put it in between the video. Like, you know, I'll cut it and then put it in there. But yeah, so thank you guys for listening to our story, and we will be posting every day in December. We're gonna try. It's called Vlogmas, but I won't label it as Vlogmas. I'll just do a video every day for the next, until New Year's, okay? Wish me luck on that. All right, please don't forget to subscribe if you haven't already. And I probably missed something to tell you guys here, but we'll see you guys in our next video. And she's right there. Her scar is right here, and then she has another one up here. She has some, like, she has some lumps from this one here, but it's just probably scar tissue. She always tries to get here at her butt, but the doctor said maybe it's just, see, she don't want me to touch that. So she just said to watch it. But she's doing okay as for now. And we'll see y'all later.